Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Chlamydia symptoms. Chlamydia symptoms typically depend on the parts of the body where the sexually transmitted infection, STI, occurs. You might experience anal or penile discharge if these organs are involved, or you might experience pelvic pain or pain with urination with a vaginal infection. /r/n/r/n Chlamydia is among the most common STIs in the United States, yet it doesn't lead to symptoms in many cases. Complications can arise without diagnosis and treatment. Talk to your healthcare provider about chlamydia concerns and regular screening to make sure an infection is caught and treated early. /r/n/r/n More than 80% of cases in both males and females are asymptomatic, without symptoms, but when symptoms do occur, there are some common patterns. Symptoms include /r/n/r/n Symptoms may not occur for several weeks after exposure. In some cases, the infection can be present for months or years before it is finally detected. During this time, other partners may become infected. /r/n/r/n Most people who have chlamydia feel fine. A lack of symptoms doesn't mean there's no infection, though, so annual screening is recommended in females age 25 and younger and in females older than 25 who have risk factors like multiple partners. /r/n/r/n Symptoms the less common include /r/n/r/n The complications of chlamydia infections can be serious and affect you even if no chlamydia symptoms are present. Such complications are largely preventable through regular screening and prompt treatment. They include /r/n/r/n Unlike the more common subtypes of chlamydia trachomatis that cause infections, there are some, L1, L2, and L3, that can cause a more severe syndrome known as lymphogranuloma venereum LGV. It takes longer to treat and involves systemic symptoms and lymph node swelling that can sometimes be confused with diseases, like syphilis. /r/n/r/n About 15% of females with untreated chlamydia will develop PID that either produces symptoms, acute, or few or no symptoms, asymptomatic. Delaying PID treatment increases the risk of infertility and ectopic pregnancy by nearly threefold. /r/n/r/n Chlamydia typically is treated with an antibiotic called doxycycline. The recommended dose for adults and teens is 100 mg, taken twice a day for 7 days. Some people may need other antibiotic options, such as Zithromax, azithromycin. /r/n/r/n It's important to complete the prescribed course of antibiotics. Additional steps in chlamydia treatment include /r/n/r/n If you've tested positive for chlamydia, it's important to also be tested for HIV, syphilis, and gonorrhea infection. Retesting after 3 months also is recommended. Pregnant people who are treated for chlamydia infection should be retested after 4 weeks and again 3 months later to ensure therapy was successful and/or infection has not recurred. /r/n/r/n Keep in mind that once you've been successfully treated for chlamydia infection, it can still happen again. You can prevent chlamydia and other sexually transmitted infections, STIs, through safer sex practices that include consistent condom and dental dam use. /r/n/r/n It's important to talk to your healthcare provider if you have any signs or symptoms of chlamydia, any other symptoms that concern you, or if you know or think you've been exposed to the infection. /r/n/r/n According to the U.S. Preventive Services Task Force, USTF, women 25 and under and those who are sexually active should be screened for chlamydia every year, as should older women who have an increased risk of infection. /r/n/r/n Screening for other STIs is important as well, as the risk factors for chlamydia also increase the likelihood of contracting these other infections. If you are treated for chlamydia, tell your healthcare provider if any symptoms persist. /r/n/r/n Chlamydia is one of the most common STIs in the United States. although many people do not experience symptoms. When they occur, they can include a burning sensation in both males and females when they urinate, as well as discharge from the penis or vagina. /r/n/r/n If left untreated, chlamydia can lead to serious complications that affect fertility, cancer risk, and more. Speak to your healthcare provider about symptoms and diagnosis, and be sure to ask about routine screenings. /r/n/r/n Get our printable guide for your next doctor's appointment to help you ask the right questions. /r/n/r/n Sign up for our Health Tip of the Day newsletter, and receive daily tips that will help you live your healthiest life. /r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.